Coach Els. Thanks for joining me today to have a chat all about Nurse Assist 24/7.
Thanks for having me.
Yeah, it's always great to catch up with you. To begin with, can you tell me a little bit about Nurse Assist 24/7, your journey, how you started?
Yeah, well, Amanda Damon, she's our founding director, and she's got a background. She's a registered nurse and specializes in ICU and intensive care. And when she immigrated to Australia, she was introduced to the disabilities sector via Lady Lawley Cottage. That was one of the first places she worked, and it really opened her eyes at the need for high intensity complex care for kids, and the services that they provided in Respite really touched her. When the opportunity arose to start a business in this space, she jumped at it, and we've been growing the business ever since. It's gone in leaps and bounds. We started off as a small organization, just 3 staff, and we're nearly at 103 now in the space of 3 years, and there's quite a large need for high intensity complex care for participants.
And so you're a Perth-based, predominantly SIL provider.
Yes.
And you do focus on complex care, and that's kind of your wheelhouse.
Yeah. So Perth-based, Rockingham. So that's where our head office is.
Yep.
And we have 5 SIL homes in the Rockingham area.
Yeah, beautiful, amazing. So can you walk me through some of your notable milestones or successes that you've had over the last 3 years as an NDIS provider?
Yeah, so because we specialize in high intensity complex, we had our first ventilator participant come on board, and initially they were struggling, and they were unstable, and they were transitioning from one type of ventilator to another, and we helped with that transition, giving feedback to the hospital as to what settings worked and what didn't work. And over the journey, it took a bit of time and a lot of effort from our nursing team to get them settled. I think that was a great achievement, and also by nature of that, it upskills our staff, because crucial role of the nurses is to train our support workers, assist them to look after the participants, and it upskills them, and it allows them to grow in the space by looking after complex participants.
Yeah. And what do you think is the most rewarding part of being an NDIS provider?
I'd have to say that the transition from hospital, so going to visit a participant that's waiting to be discharged, but they don't have any place to go, and they find our organization, and that initial visit, going to the hospital, sitting down, listening to them, what are their requirements, and seeing what we can provide for them, if what we have to offer is right for them. And then facilitating that transition with the PBS, training the staff, and getting that right, because that's such a crucial part in the transition process, those first few weeks. And then visiting the house 3 to 4 weeks later, because I do random pop-ins to all our SIL homes and drop off some goodies and things like that, and then just seeing someone that was in distress in hospital, that once was in distress, now happy and thriving in a SIL environment, that is very rewarding.
Yeah, beautiful. What do you find is the most challenging part of being an NDIS provider?
There's many challenges. I think staffing is a big one, and also managing occupational health and safety, operations, and navigating the NDIS, because there's a lot of information, but just navigating your way through that is quite challenging. But I definitely have to say, you're finding the right people that fit with your organization's core values, and getting them across and and being able to provide the service that you want with the right people.
Yeah, I agree. Staffing is a real challenge, and also the rapid pace of change in the NDIS and keeping up with that as well.
Yeah. Staffing, rostering is another big thing as a sole provider. Getting that right roster of care set up, and having a software system that can
Manage all of that.
manage everything.
Yes. And so Nurses 24/7 has worked with Tanya Gomez Consulting for about 6 months or so now. What were the specific challenges you were facing in terms of being audit ready, or in regards to your quality and compliance, that made you decide to engage a consultant?
Yeah, I think as we grew as an organization, by nature, your workload increases, and finding the time to go through and do that initial internal audit is challenging, because the operations is always there, and then the HR component and managing that part of the business. I think that was the great deciding factor for us. We want to do it, it's there, it's on the list, but finding the time was challenging. So I'm an avid podcast listener, and came across yourself and bumped into you at a few events. And your passion, enthusiasm, and excitement. I'm like, she's excited for compliance. She's excited about compliance. I want to work with her.
Thank you. Yes, I'll take that as a compliment. I do try to make compliance fun as much as possible, but yes, I know it is a otherwise laborious task.
Just all those folders and files and policies. Yeah.
I love that. I love that.
Tip my hat to
totally
you
my
for
jam. And can you share some specific examples of how doing an internal audit helped you prepare for the audit process?
I think it's just providing a clear roadmap and just identifying gaps. Like, for example, I think one of the things was a support plan. Right. So the nomenclature, we call them care plans in our organization. And the nurses review them every 6 months. And I think it was highlighted during the audit that it was difficult to find that information within the folder structure. So we quickly turned that around and fill that gap to make it easier to find and better alignment with the compliance regulations. So I think that was one thing that stands out. From there, it's just streamlining it and making it easy for the auditors to find the information that they require during the audit, because we know where everything is. But having it simple and structured. Correct.
And you've engaged a virtual compliance assistant through Care BPO, which I have the privilege of training and supporting. How was the experience of having someone in the Philippines help with your compliance? What has that been like?
It's been excellent, I must say. And I was listening to the podcast on the Profitable Provider podcast with yourself and Paul, and when you were discussing with Chris, I'm like, that's brilliant. So I touched base with Lee and Chris, and we started the process, and it's seamless. And the way the collaboration between yourself and Care BPO was awesome, because a lot of the time you get approached by different organizations, and it's all, we can help you and this and that, and on the back end it isn't that great. Whereas with yourself and Care BPO, it's seamless, because you advise on the training part of the compliance, and then we engage you to the internal audit. So the onboarding process was excellent, because the compliance officer was able to see why he's doing what he's doing, and then you provided him with the roadmap to then follow. So I really value that, because as I said before, as your business grows, you get pulled in different directions and operations and things of that nature. So it just took away the stress and anxiety. and the
And
process
having
very smooth.
one dedicated person to do all of those things,
Yes.
and make sure that you're not having to pay me at my hourly rate, that you've got someone on a cost-effective rate that can do things like, okay, we need to reorganize these files and move these from here to here, and but having the framework of what should that look like in the end, surely that gives you a level of reassurance of you don't have to really worry now. You've got someone in-house doing it, it's cost effective, they've been trained well,
Yeah.
and it means you can just leave them to get on with audit prep and go back to operations.
Correct. Yeah. They're in a bunker.
Yeah.
And that's their sole job, because it's important. It's very, very important.
Yeah.
Role within the organization. And no, I can't speak highly enough of the both of you guys.
Yeah, thank you. And can you talk to me a little bit more about Nurse Assist 24/7, and I guess what makes you different from other NDIS providers?
I think at the heart of it, it's our nurses. They're integral in everything that we do. Because we specialize in high intensity complex requirements, nursing is an essential part of that. And like the nurses assist in training of the support staff, which is so important. They provide tailored care plans at that initial assessment and make sure that each one of our participants has that specific plan created for them that allows our support staff to support them as best as possible. We also we have like a hub arrangement in Rockingham, so all of our houses are about 5 minutes from head office. So twice a day, our nurses visit each SIL home and check in with the house supervisor, check in on the participants, seeing how they're going. If they notice anything, make recommendations or tweaks to the care plan. If they notice something, they say, okay, well, we might need to make an appointment with a specialist to have a look at that. So it's that daily interaction with everybody, and it also assists the support staff in feeling comfortable, because especially a new support worker coming into a high intensity environment, having that reassurance that you're going to have somebody there to assist you with taking care of these complex participants. Also, by nature of the high intensity, a lot of our participants are looking for specialist disability accommodation or have it in their plan, and it's never been utilized. So we actively collaborate with SDA providers to see if what they have is suitable for the participants and assist them with that. Our Respite is another very important thing that I'm proud of. As I said, Amanda working at Lady Lawley, and that high intensity respite for children with complex needs. So we provide that service, and what that looks like, say a family's in Bustleton and they need to come down to Perth, or come up to Perth for medical appointments at Perth Children's Hospital. And typically they have appointments scheduled over a few days. So they'll come and leave their loved one with us, and then we'll send a support worker with them to the hospital and assist them with the appointment, and then they can come back, leave their loved one with us, and have that peace of mind that they're being catered to. And then they can have respite, go have some dinner or see a show, or go watch the footy at Perth Stadium. And that's worked really well. So we always have capacity for that. We have dedicated houses that facilitate that. We also do crisis care, so after hours crisis care. So if a participant ends up at hospital and they have NDIS funding, the social worker will reach out to the after hours crisis care. They'll call us and say, do you have capacity for emergency respite? And that's another service we provide that's great. And also Department of Communities, we work with them also to provide housing for some of their participants as well.
Sounds
Yeah.
like you have a great range of different supports for people with complex needs. There's
Yeah.
lots of different things there that they can come to, whether it's full-time accommodation, respite accommodation, different supports that you offer. And 5 houses in 3 years sounds like quite a lot. What's your plans next? Where do you see yourself in the future? How many houses are you aiming for?
Well, I think collaborating with SDA providers has been excellent in that we can utilize the accommodation, or we can do a B2B arrangement, or just refer participants to them, and we provide the supports.
Yeah.
You know, because initially we had to invest a lot of capital into buying properties because we needed the property to provide the supports.
Yes.
And at the time, SDA, everything was still on paper.
Yeah. Yeah.
You know, and still being built. So I think 24, 25, we're going to continue our relationships with our various SDA providers and utilize their properties. Our SIL is still important. We're going to grow organically in the Rockingham area because that's our hub.
Yeah.
You know, and we've got the beautiful foreshore there. We've got Penguin Island.
Penguin Island is beautiful. I have been there.
Yeah, it's great. And we've got a new house in Shoalwater, which we've built, and we've got something exciting planned. Q2. We're nearly in Q2.
Yeah.
To develop our own SDA,
Yeah. Wonderful.
and that's going to be, I think we've got 1,200 square meters in Rockingham there. But yeah, that's a 2-year plan.
Yeah.
We've got we purchased a property in Gilderton in the north of Perth, in Moore River there, and we're wanting to expand our respite and group activities for our more able participants to go and kayak on Moore River, go 4-wheel driving in Lancelin, you know, increase those group activities.
Yeah.
Because typically it's there are good organizations that do group activities, but that high intensity side isn't catered to as much. So
Yeah. Yeah, beautiful. Sounds like there's lots of exciting things coming up for Nurses 24/7.
Thank you.
Yeah. So I wanted to ask you a little bit more around working with Tanya Gomez Consulting. Can I ask you to highlight any unexpected benefits that came from the internal audit? Was it just meeting the audit requirements, or were there other things that came out of being able to do an internal audit that positively affected the business?
Yeah, I mean, when you start off as a new organization, I think everybody buys the template package.
Yeah.
You know, and it's got all these documents in it.
Yeah.
And you don't really know what all of them are there for.
Yeah. You don't know why you
But
have them.
You don't know why you have them, but you've got all of them.
Yeah.
And as you then grow and use and implement the policies and procedures, you say, oh, this is handy. But then there's some that you don't touch. And I think when you went through it all, you gave us a clear roadmap as to what is.
Yeah. Why do you need them?
Why do you need that Simon Sinek book, starting with why?
Yeah.
You know, once you know why, then you can answer any how. So I think that was very important.
Yeah.
And also the policies that we do have, can we make them better, or by your recommendations, tweak them slightly to have better alignment? So that was invaluable. And we constantly reviewing.
I think when you buy things off the shelf, the other thing is that a lot of people say to me is, I bought these policies, you know, and I know the core policy pack's probably 300 pages and you get probably 100 forms with it.
Yep.
So you get all of this and you know it's past audit, and a lot of people are then scared to tailor or edit anything because they feel like, well, I can't remove anything. So I've been to organisations that have 5 risk assessments and they think they need to use all of them, or 3 different support plan templates and they're using all of them because they don't realise they can choose or that they can edit those and make them their own. And so I think, like, even coming into your organisation, the difference between care plan and support plan, saying, well, no, it's okay, you can call it care plan, we just need to make sure it also has these elements so that the auditor can say care plan equals support plan and give you a tick in that box. So really having a look at those and going, well, how do we tailor this to fit you so that you actually have documents that you can use in your business, as opposed to just a whole lot of documents you give at audit but actually don't get used in your business and become a really expensive doorstop, really. They're not much else than that otherwise.
And it's getting ownership of the documents as well.
Absolutely.
So our nursing staff, our clinical nurses especially, after the internal audit, they went through and streamlined everything, and even like our participant, what's the
handbook.
word? Yeah, the handbook, and there's another one, the consent forms, because we had 10 different consent forms, because there's catheter consent, wound management consent, all those different
privacy, sharing information.
So I was just consolidating that as well during the review, just so it's clear and concise and you don't have to navigate through all these things.
So you've really taken ownership of the documents, streamlined the documents, and been able to figure out what is and isn't useful in your business by going through the internal audit process and figuring out what you do and don't need to be doing in the business. Beautiful. And how would you rate the quality and compliance training for your offshore staff member that we took through that process?
Oh, it was brilliant. It was absolutely brilliant. They spoke highly of you after that initial training. Like, oh, Ray, Tanya's so amazing, and and all the resources you provided. And I think they made reference to a video where you had a live session with compliance, and the questions that your compliance people were asking during that session were questions that he had in his mind. So that was a valuable resource, and all the training on your portal was excellent. And in the start he had no clue, and then at the end he's like, this is excellent, and
ready to hit the ground running.
Correct. And that's what you want, because it's so fast paced, and the audit date comes so quickly. We started this journey, I think we started talking about in October of last year, and now it's around the corner.
It does. It creeps up. You think that 18 months is a long time, but by the time you get organized, it actually brings it down to a very small window to get a really lot of things done. Well, good luck in your audit. I have no doubt that you and your compliance assistant will do an amazing job to get through. And thank you so much for sharing your experience of working with Tanya Gomez Consulting with me. And I can't wait to see what's next for Nurse Assist 24/7.
Thanks for having me.